The Government Employees Medical Scheme's annual Symposium starts in Cape Town today. The two-day gathering aims to inspire strategies that will contribute to the global pursuit of comprehensive and inclusive health coverage. Let's cross to our reporter who's at the event, Lulama Matya. Lulama, a very good morning to you. Perhaps you can tell us what we can expect going forward today.
Good morning, Leanne and the viewers, and welcome to Cape Town. We are at the Century City Conference Center, where this annual Symposium of GEMS is currently happening. It's going to kick off soon. The stage is set. We're waiting for the attendance to arrive so that the event can begin at this in 2024 on when the country and the world is facing a number of challenges when it comes to health matters. But to talk to us more about this event, I am joined by the GEMS Principal Officer, Dr. Stanley Molwabi. Welcome to the SABC, sir.
Good morning, Lulama, and good morning to the Morning Live viewers.
Talk to us more about the purpose of this symposium.
Well, the intention is to foster a dialogue relating to issues around universal health coverage, which, as we know, it's really the main thing that is at the top of any healthcare provider out there. So our intention is to get together healthcare providers, health funders, and most importantly, innovators who will bring some solutions to the problems that we face in healthcare.
You're talking about universal coverage, and we know that President Cyril Ramaphosa, before the beginning of the 7th administration, he signed the NHI into law. What is the position of GEMS in when it comes to NHI? Because that legislation is facing criticism from some quarters. What is the position of GEMS on that?
Well, the position of GEMS is basically that the reality is we do have to transform the way healthcare is rendered. You know, people talk about a sort of a two-tier healthcare system in South Africa that needs transformation. And the ultimate aim of universal healthcare coverage is that those who need healthcare should have access to healthcare, not because they can afford it, but it must be based on a need basis. So the NHI, which has now been signed into act, the main intention and the goal is to take the country towards achieving universal healthcare coverage goals. Well, there are challenges. We are aware of the challenges that are there, and these are based on the fact that, you know, when policy changes on something that people are used to, there will be challenges. And these challenges, I want to believe, based on what was reported in the past week or so, that the President intends to give a chance to those that have a problem with the NHI Act in its current form. There are engagements, as you are aware, and our wish, and I believe that we will find solutions, as we always do as South Africans.
Mm-hmm. You're gathering at this point in time whereby the world, including South Africa, is facing very serious challenges when it comes to health matters. With more than 2.3 million beneficiaries, what are some of those challenges that would you say you will highlight that are facing the health system in this country?
Well, in terms of our beneficiaries as GEMS, yes, as you say, we cover over 2.3 million beneficiaries. So those are the ones who are insured by GEMS. The challenges that really are faced in general are those of affordability. And it is our focus on ensuring that as best as we can, we try to make GEMS to remain affordable while not comprising access to quality health care that our members are entitled to in terms of their benefits.
You're gathering this year under the topic of innovative, integrate and accelerate. What does that mean broadly?
In terms of innovation is about solving problems. So we need to find new solutions to existing problems. And then in terms of integrating is basically when you look at healthcare delivery has to be integrated in that there has to be what we call care coordinations, which we have implemented very successfully within the GEMS environment. And accelerate in this context simply means that let's implement those things that we can implement immediately, even if there are challenges with policy changes that we're experiencing. We have spoken about the NHI Act. It doesn't mean we must wait until every signature allows what needs to be promulgated in the Act. No, we must implement things that we can. One of the precursors of universal healthcare coverage is strengthening healthcare systems. And in simple terms is we have to look at the infrastructure, we have to look at human resource issues, we have to look at systems that are used in healthcare delivery, and then we have to look at the actual product itself.
Thank you very much for your time.
Thank you very much, Lulama.
Leanne, that was the Principal Officer of GEM, Dr. Stanley Molwabi.